Okay. Well, thank you everybody for joining us. Quick update on where we are in the pandemic in Colorado. 28,339 positive cases, 1,292 deaths due to COVID in Colorado, 1,547 people with COVID who died. Each one, we send our heartfelt condolences to the families. Everyone, a brother or sister, a friend, a mother or father. And of course, there are still losses ahead. In a challenging period for Coloradans and for Americans. We see COVID-19 on the rise in some of our neighboring states, Utah and Arizona. Thanks so far to Coloradans' extraordinary efforts to be 6 feet apart from others, to wear masks when in public. So far, we haven't seen that same trend here. But it just shows how tenuous this progress is and how important it is that we continue our efforts for social distancing and being further apart from others when we do interact. And just being careful, being smart, being careful, wearing masks in public. We can get through this. We will get through this, and we want to do it with minimal loss of life. We have, good news in terms of hospitalizations. 11 of the last 14 days of a downward trend. For new cases, it's more mixed. 7 of the last 14 days of a downward trend. So mixed there, but still less hospitalizations. And yeah, we are warily watching Utah and Arizona, neighboring states that have both shown substantial increases in COVID-19 just in the last week. I also want to begin today, and I had my mother come on a couple weeks ago, and I also wanted to begin today a conversation not with my mother, but with a colleague of mine who is over 65, and that is our Lieutenant Governor, Diane Primavera. And what she is going to talk about is two things. One is how she has stayed home, reduced her risk, and continues to do so, but also how she's been incredibly productive at home. Just because we are avoiding going out except when we need to, the park, groceries, we're not, avoiding seeing friends if you're over 65, avoiding seeing family when you can. That doesn't mean you still, of course, can stay connected. I showed that. In fact, this morning before I left home, my son, 8-year-old son, was video conferencing with my mother, and he was playing the piano for about half an hour. When I went in to say goodbye to him, he said, "Get out! You're interrupting me." He was very enthusiastic about sharing with Grandma the new song he learned to play on the piano. But it's not only about the social connection, the emotional connection. Frankly, it's also about being able to be productive at home, thankfully, because of new technology. So with that, let me welcome our incredibly productive Lieutenant Governor of the state of Colorado, Diane Primavera. Diane, are you with us?
Yes, I am, Governor. Can you hear me?
I sure can. Oh, there you are. Look at that. So tell us, how have you been handling this COVID-19 pandemic?
Well, as you know, and as you mentioned, I'm really in 2 risk categories because of my age and also as a cancer survivor who's been diagnosed 4 times. So I also fall into the population of those with an underlying health issue. So I'm coming up on 3 months in my house. It's been really difficult, but thankfully I have work to do to keep me busy. So I've been able to cope really pretty well. So I just want to say, family connection is really important right now for people. So grandparents call your kids and your grandkids, and kids call your parents and grandparents, and make sure you're giving them the love that they need, because the isolation really can be overwhelming. So, and please reach out to any neighbors that you might have to offer to bring them groceries, supplies, because it really does make a difference.
So I know you've been incredibly productive, because I am usually on 1 or 2 video chats or calls with you each day, and I know that you're on many, many others. Walk us through a little bit of the work you're doing remotely and kind of how that feels and what you've been working on as Lieutenant Governor of our amazing state.
Well, first of all, I miss being around everybody, but like many of you, even though I'm not physically with my staff and my colleagues, I'm with them on Zoom and WebEx and a multitude of virtual platforms every single day. So let me talk to you a little bit about what I have been doing. As the state's lead on the aerospace and defense industry, I was really delighted that Peterson Air Force Base in Colorado Springs has been designated as the provisional headquarters for U.S. Space Command. And we're working hard to make Colorado the permanent home. And this is an incredible joint effort, and I'm really proud of our team. This means a lot more jobs coming to Colorado, and once again gives us a chance to showcase our state workforce's unique talents and our state's competitive advantage. We've also been focused on the Behavioral Health Task Force, and I'm excited to be heading up the new COVID-19 subcommittee on the task force. And we know right now that many Coloradans are really struggling with feelings of isolation, as we said, loneliness and anxiety, and the most difficult of all, grief. So if you need help right now, there's a Colorado Crisis Service, and it's just a phone call away or a text a few clicks away. So you can call 844-493-8255 or text TALK to 38255 or visit coloradocrisisservices.org. So we all need to do our part right now by and for each other during this global pandemic. Another thing that I've been working on is I chair the Colorado Commission of Indian Affairs. So I've been meeting with the Southern Ute Indian Tribe and the Ute Mountain Ute Tribe, as well as the Urban American Indian Alaska Native Serving Organizations. So we've also established a health and wellness committee to focus on COVID-19 in Indian country. In my capacity leading Serve Colorado, which is AmeriCorps and VISTA, we're proud to be working on contact tracing in Colorado. And Colorado is getting more than 800 contact tracers from AmeriCorps. And we encourage individuals interested to consider signing up at colorado.gov/servecolorado/contact tracing. So this contact tracing will improve our response to outbreaks, which will save lives and allow us to reopen things more quickly. And finally, and of course, I've been focusing on saving people money on healthcare. And my team is actively supporting the state's Emergency Operations Center and the Innovation Response Team on COVID-19 and brought a consumer focus to policy efforts to protect Coloradoans in this historic time. So I was proud to lead the crafting of a telehealth executive order in partnership with state agencies to ensure Coloradoans could access affordable health care and providers could be reimbursed for care that was safe during this pandemic. So I'm really proud to say that now over 75% of health providers are able to use telemedicine to deliver clinically appropriate care to Coloradoans during this time, and virtual COVID-19 healthcare is free for consumers during the pandemic and the response.
Wow, so thanks for all your amazing work and your productivity. But as we all know, all work and no play makes us dull people. So what, in addition to being incredibly productive for the state of Colorado and saving people money on healthcare, looking out for our tribal nations, our aerospace industry, what have you been doing for fun, and what have you been doing to spend the time where you're not working hard for the people of our state?
Even when you're quarantined, exercising is really important. It's really important for both our physical and mental health. So I get up and I move around when I'm working, and then I also get a lot of exercise walking my dogs. So I'm glad now that we're entering the sacred home and the vast great outdoors phase, because we have some amazing public lands right near my house that we've been frequenting to getting some fresh air that we all need.
And you have 2 or 3 Airedales, I forget, 2 or 3.
I have 2, but it seems like 3.
Yeah, well, I'm sure, do they like having you home all the time?
They do, but I think they're ready for me to leave so they can have the house back.
We are all so ready for this pandemic to end, but it is not over yet, and it's very important to recognize that. Actually, COVID cases across the world are increasing, including in our neighboring states of Utah and Arizona, and we have to remain very watchful here. Anything else you want to share about how you personally or professionally have been dealing with this pandemic?
I think you and I could both agree that COVID-19 has been the most daunting challenge of our careers here. But I'm really grateful for the tremendous partners that we've had the opportunity to work with, from industry partners to our faith leaders. And I've been impressed by our whole society response. When I've had really difficult times in my life, one of the things that I think was the best practice that I adopted was it to maintain a daily gratitude journal of all the things that I'm grateful for. So during this difficult time, sometimes it's really hard to find something positive. But if we take just a little time out every day at the end of the day and write down 3 things that we're really grateful for, and they have to be 3 new things every day, from the birds singing to the sunshine on your back when you're working in the garden to garlic sauteing in the olive oil. It really changes your life and really gives you a more positive outlook. So I'm hopeful that everyone could adopt this practice, and it's been really helpful for me during the last few months.
Thank you, Lieutenant Governor, for sharing your wisdom with us, for telling the people of Colorado what you've been up to, how you've been able to be incredibly productive while staying safer at home and in the great outdoors, being a great role model, a great grandmother, and an incredible Lieutenant Governor who's working hard to save people money on health care. So thank you, Lieutenant Governor Primavera.
Thank you. It's an honor to work with you.
So, and Coloradans across our state are being incredibly productive from home. We know not every job can do that, and people are back at work and, in factories, and they've always been at work at farms and construction during this entire period, and honestly, taking on some degree of risk to be able to earn a living, put bread on the table, and keep our state productive and prosperous. But a lot of folks are able to telecommute. And a lot of companies, I was on the phone with one of our major aerospace companies just the other day, and about half their employees are telecommuting, and they're just as productive, and it's helping to decrease the spread of the virus without sacrificing any economic productivity. And for those who can, and for employers that can adopt and continue to do that, it's a great way to do it. We're doing that as a state. We are an employer over 30,000 people, and we have about half our workforce telecommuting, and we believe that we can sustain a good number telecommuting for a period of months without sacrificing any productivity at all. So I'm going to say a few words about the legislative session. This is June. We don't always expect our legislature to be in session, but because of unprecedented times, they are hard at work, doing the work that needs to be done for our state. And first and foremost means passing a budget, because the way that the state operates, our year ends at the end of June. So if the legislature doesn't pass a budget, the state runs out of money for July 1st across every single enterprise that we do. So it's really important with fire season, with schools in August, with everything happening, that they do their work, and they're doing a wonderful job getting things done quicker than usual, efficiently, honoring the right of the people to participate. And I want to thank them for working on a very difficult state budget. I know it's just as it's personally hard on the beneficiaries of different programs that were cut, it's very hard on those thoughtful and caring legislators to have to vote for a package that, because of the times, requires deep cuts to critical programs that they care deeply about. And we know that, in this time, just like all the difficulties we're experiencing from the health perspective and the economic perspective, these difficulties are temporary. And we know that as things get better, when there's a vaccine, when there's a cure, when we're able to manage this virus and not have it spike, we're looking forward to restoring some of those cuts. Families are looking forward to restoring their family budgets. Businesses are looking forward to hiring again. And one of the things we're working on with the legislature this quick session is that resiliency. How do we have a strong economic recovery in Colorado? How do we support the businesses, the workers that are struggling because of COVID-19? And I'm so glad that the legislature is taking action on a number of fronts on that area. They're doing a loan relief fund and small business grant program to help small businesses weather the crisis, especially small businesses that weren't able to participate in those federal paycheck protection programs. They're shoring up the unemployment insurance program, working on paid sick leave, so people who are contagious don't have to go to work just because they can't make rent, and they can take a few days. Many of us who are salaried take that for granted, that if you're sick and contagious, you don't work. Many hourly employees don't have the luxury of taking that for granted. That's going to be important in fighting the pandemic. And of course, using the coronavirus relief funds for housing, for food and energy assistance, for people to stay ahead of on their bills. And I'm also excited that they're taking action on doing longer term relaxation of some of the regulations, like regulatory relief on curbside pickup and delivery of alcohol, turning that into a law. Really looking at structural issues, bipartisan support for repealing the artificial formula of the Gallagher Amendment, which forces a Denver Metro solution on the whole state. And I also want to praise them, of course, for being in the process of taking swift action in response to the hundreds of thousands or millions of Americans that are demonstrating against police abuse and structural racism. And that's a great example of Colorado working together, passing a major reform bill with a nearly unanimous vote, 32-1. It really shows a great example of what Coloradans can do when we realize a common problem and we roll up our sleeves and we tackle it together. And 95% of the legislation I signed last year after the legislative session was passed with Republican and Democratic votes. And this is another example of the collaborative spirit that I think shows what Colorado can do together and how we have more in common than what separates us. I also want to take a moment to talk about our great success with the Charitable Fund, the COVID-19 Relief Fund. So far, we've raised $18.9 million. 4 rounds of awards have gone out, and these are donations from individuals, from corporations, and from foundations. So far, $14 million has gone right out, supporting 650 organizations, every county of the state. Now looking at applications for round 5. These small charities, community-based organizations are really able to deliver help to where it's needed the most. People can contribute at covid19.colorado.gov. I'm sorry, it's helpcoloradonow.gov for that one, helpcoloradonow.org, helpcoloradonow.org. Too many websites. I want to highlight a couple examples of some positivity. One is Grow House in Denver. It's a source of fresh food in the Elyria, Swansea, and Globeville neighborhoods. They built a strong community trust by using staff from the community. When COVID hit, they got a huge increase in the number of households that were looking for basic food. So they mobilized their team. They started packing and delivering emergency food packages. They got help from the COVID-19 Relief Fund. They're currently serving 2,500 residents with nutritious food. They're partnering with a number of other great community organizations like Denver Food Rescue and We Don't Waste. And it really is showing how we as a community can help reduce the negative impact of the COVID-19 crisis on those among us who are most vulnerable. The second organization I want to highlight is the River Valley Family Health Center in Delta, Montrose, and Olathe. They have stepped up IT support for telehealth so that people don't have to come in for their treatment. They've contracted with local contractors to install a negative air pressure room to increase ventilation. They take staff temperatures twice per day and the temperature of every person who visits the facility. And they have increased the level of cleaning at all of their clinics. And they've also offering one of our 46 sites across the state that offer free, quick, easy COVID-19 testing. And for those who have participated in the protests, I encourage you to go to the Pepsi Center 7 to 10 days after you've been in public with others. Please get a free, quick, and easy test. 46 free, quick, and easy testing centers across the state. covid19.colorado.gov. That's the website. Click on community testing sites for that. Those are just 2 of the hundreds of incredible organizations that help coloradonow.org, and your donations are helping to make a difference in Colorado's time of need. We're all in this together. We're going to get through this by doing right by one another, by loving thy neighbor. That is how we will get through this stronger and more resilient than ever before. Thank you, and I'm happy to take some questions.
Governor, since you talked about the legislature, I'm curious if you have any thoughts on House Bill 1420, which was introduced yesterday and would eliminate a series of tax exemptions and tax breaks, seeking to boost the general fund and send about half that money to education.
Yeah, we have not reached agreement with the legislature on fiscal reform. I ran on a platform of eliminating tax loopholes and recovering the revenue to reduce the income tax rate. We are happy to negotiate with all parties and include other parts of the package that can have backfill some state revenue and have earned income tax credit as well as income tax cut. And we certainly welcome any negotiations with the legislature, but there's no agreement on fiscal policy yet.
I have a two-parter. So first, where do we stand in terms of PPE? And then the second part is how prepared is the state for the potential of a second wave of infections?
Yeah, we periodically do updates on personal protection equipment, and we'd be happy to include one in one of our next conferences. I have daily calls on our status. We don't have any active shortages of personal protection equipment, but that doesn't mean we always wouldn't appreciate more, which is why we're buying more to get it out to first responders, to communities, to others. We've established more reliable supply chain relationships internationally and domestically for high quality personal protection equipment. We will be happy to give you the numbers that our efforts have led to the acquisition of here in the state of Colorado, and that's on top of whatever our hospitals and private providers buy on their own. Ours goes to other generally smaller entities that have been unable to access the supply chain themselves and are very important in containing the pandemic. What was your second question?
How are we preparing for potential of a second wave of infections?
Well, supplies are one indicator. So, of course, we're working on testing, personal protection equipment, gearing up the tracking and tracing. Lieutenant Governor Primavera updated us on the AmeriCorps piece, the Serve America piece, working with county health departments to make sure that we are ready. And to be clear, it's not so much a wave. The first wave isn't over. It's here. Coronavirus is here. It's not going away. The minute we let down our guard, the minute we are not vigilant, it will have a resurgence of cases. And that's why we need to continue to stay 6 feet from others where we can, to wear masks in public, and why people over the age of 65, like our Lieutenant Governor, should take additional precautions and really stay home whenever they can and enjoy our public land and outdoors, but not go to gatherings. They're at much higher risk of hospitalization and much higher risk at severe complications and mortality. Telephone?
Governor Polis, good afternoon. It's David Clue at Denver 7. With airlines already announcing added flights in and out of Colorado and the RV travel idea being promoted as the safest way to vacation this summer, and our state campsites now filling to capacity, how concerned are you about the influx of visitors from other states, given 26 of those other states are now seeing rising numbers of COVID-19 cases?
Well, first of all, I had not heard, and I'm thrilled to hear through you that airlines are restoring flights to Denver. They had really been cut back. I hope that those are our major carriers. I applaud the increased service to the Denver metropolitan area. We also have great private and public campsites across our state. And every year, Coloradans avail themselves of camping. My cousins went camping last weekend at one of our state parks, and also others from across the country come here. I really think that it's important that communities that are host to visitation really have a lot of the same precautions we're all taking, and that, you know, for people who work in retail stores, they're wearing masks, they're engaging in social distancing. Of course, some of those visitors might reintroduce and bring back coronavirus with them, but we also have coronavirus here already. It's endemic in Colorado, so it's important we take those precautions whenever we interact with members of the public, whether they're from our state or whether they're from another state or country.
Phone?
We'll go to another one from the phone.
Hi, Governor. Ed Seelover with the Denver Business Journal. I know you had a phone call Friday with hotel leaders about their efforts to try to reopen to special events. Are you making any progress after that phone call in moving to reopen to events of more than 10 people that can be held inside hotels or other meeting halls? Thank you.
Yeah, we have a lot of, I do a lot of outreach every day, you know, to the business community and others. And I'm confident that as soon as people are ready to return for conventions and meetings, that Colorado will absolutely be ready to accommodate them. So if there's flights returning to Denver, that's a good first step, because if people can't get here, we can't host things. And we, of course, look forward to working with any of those venues on how those meetings can be hosted in as safe a way as possible. Many of them have several months lead time. They inform me that a month or two ago, much or all of their business for June, July, August had canceled. Some of them have business on the books September, October, November, December. Perhaps some have August business. But generally speaking, it's business for later this year. And as long as conventions are happening, as long as there's business to be done, Colorado, of course, wants to host it and do it in as safe a way as possible.
Governor, I know that there were some black leaders who met with you just before this news conference, and I think Tay Anderson tweeted that he wanted you to reopen some of the investigations into the deaths of Elijah McClain, Devon Bailey, and Michael Marshall. Obviously, I know you don't have the ability to reopen those, but I wonder if you'd consider asking the Attorney General to launch a grand jury investigation into any of those deaths.
Well, just two things on that. I did speak out on the matter of Devon Bailey with regard to requesting an independent investigation. I would also add, and I don't have the latest language from the bill, but it is my understanding that the police reform bill includes a process for independent investigation into officer involved killings. So and I hope that that's part of it, and it's my understanding that it is still part of it.
Would you ask for any of those tests first? I can look at those from the AG.
Well, look, I think whenever there is community mistrust about the outcome of an investigation, it's really important for stakeholders to have a process that is fair to those involved, as well as gains the confidence of the community. I think the Aurora City Council is having a discussion in that regard about launching something. We want to make sure we have a better framework for holding everybody accountable who violates our laws and for regaining trust in community policing and law enforcement. For law enforcement to be successful, it needs the trust of the community. And people need to report crimes, domestic abuses, suspicions, prowlers, all those things. And when that trust is broken, law enforcement cannot be as effective in keeping us safe.
Sí. Gobernador, para Noticias Univisión Colorado en español. La alcaldía anunció hoy que va a entregar cheques de ayuda económica a los indocumentados. Sí. ¿Qué piensa hacer la gobernación para ayudar a los indocumentados del Estado?
Estamos trabajando con la Cámara del Estado para hacer un programa de ayuda para estudiantes quien tiene DACA en nuestras universidades para ayuda y también para ayudar a los negocios quien no pueden recibir ayuda federal de la programa PPP.
Hi, Governor. Taylor Summers for NBC News Radio. You discussed earlier you're following the rising numbers in Utah and Arizona. I was wondering what specifically has you concerned about their surges, and would Colorado need to potentially screen and trace people coming from those states to mitigate community spread in areas on the state borders?
So it is very difficult, and we watch. I watch the global statistics, and while I watch with interest what might be happening across the country, what happens in our own backyard is even more relevant because the truth is we've had very low incidence in Mesa County in Grand Junction. They've been one of our leading areas in terms of reopening, weeks ahead of the state. We've been so thrilled to have low incidence there, and of course there are many people from Utah that go back and forth every day, every week, so we have that concern. In southwest Colorado, we already had the concern in the Gallup area, in southwest and New Mexico. While New Mexico as a whole, not as much of a hot spot, the tribal areas and northern New Mexico has been a hot spot for several weeks. Now Arizona, we have a lot of travel back and forth with Arizona. There's certainly a lot of snowbirds that spend part of the year there and part of the year here. And of course, we worry about increased incidence in our neighboring states. There are at this point no plans for checks or validations other than we encourage all Colorado businesses, and especially those who cater to people from out of state, to take all the precautions that we advise with their employees. Paperless checkouts, wearing masks, trying to be socially separated. A lot of retail stores have installed plexiglass. That's optional, but many have done that. So those same kinds of precautions that we take to avoid infection from our fellow Coloradans, we also need to take from those who might be bringing it in from Arizona or Utah or California or Texas or New York or wherever people are coming from. Last question. Is there any from the room? Yes.
So you told the State Board of Ed on Monday that children should have someplace else to go when they're not in the classroom. Can you elaborate on that? Where would you suggest kids go?
So most schools will be back on schedule most of the time, and that's really the best that we can say, because inevitably there will be site level, community level outbreaks that would require particular schools to convert to remote education for a period of time. There are some school districts that are looking at what might be called hybrid models. What is important, if they choose to go that direction, it's very important that they also are attentive to what kids do in the other day or two that they don't have the classroom instruction, especially for families who have no ability to have them at home because it's a single parent family, it's two parents that work. If they're packing the educational program into 3 days or 4 days, it could have a daycare component for that day or two that they're not in the educational program. But it's really important that districts are attentive to the needs of their parents and their families. I think they're doing an exceptional job in rising to that occasion, in being flexible, in doing contingency planning, and knowing that while most kids will be back in schools in the fall in a more or less normal way, there will likely be interruptions at different times in different places where schools have to convert to a remote format if there are breakouts at the school level. So thank you all very much. And one more from the phone. Okay, last phone one.
Hi, it's Jessica Seaman with the Denver Post. I wanted to see, when can we expect an update to visitation rules at nursing homes, and what could this look like as we continue this reopening phase?
Yeah, a cross-agency team is working on a process where people, which I laid out last week, where people can get tested and have a window to visit. We are also continuing to upgrade testing at nursing facilities, at senior centers. Throughout this, there's been a way where those in palliative care can receive visitation. There is if it's critical psychologically, that you can receive visitation, but there needs to be a more normal way. If we're going to be in this situation for a period of months, we need to maintain those personal connections with our elders and do it in a safe way. And so that process is being planned and, of course, will be rolled out and increase availability over time. But essentially what it will allow, the Lifeline Pass program, is it will allow people who test negative, who have no symptoms and no known exposure, to have a window after they get tested negative to be able to visit their loved one in a one-on-one way. So in the meantime, of course, and even after that, everybody should continue to reach out to our loved ones in senior centers and residential care virtually, telephonically, even writing old-fashioned letters. All of that is very important because we can't let this virus divide us. While it may keep us apart physically, we cannot let it succeed in keeping us apart emotionally. And that's very important for people of all ages, but particularly those who deserve to be able to enjoy their golden years. Thank you.